My name is Anani. I am one of the mentors for the Tour for Diversity. We are happy to be partnering with Health Professions Week here to have a discussion about gun violence. And most importantly, see if we can come up with any solutions, see if we can come up with any deep provoking thoughts, and see, as the title has stated, where do we go from here? I'm an emergency medicine physician practicing outside of Nashville, Tennessee. I grew up in Houston, Texas, moved there when I was 11, moved from California. My family still resides there. We're gonna go around and have each mentor introduce themselves, say what they do in all their bigwig status, and then we will kick it off. How about we start with Dr. Haamid?
I'm Dr. Haamid. I'm an emergency medicine physician here in Chicago, Illinois. I work at the University of Chicago. I'm also the Associate EMS Medical Director for the Chicago South EMS system, and it's great to meet you all.
All right, great. And Dr. Italo Brown with the festive hat, getting it started on the Christmas vibe early, I see.
Tis the season. What's up, everybody? I'm Dr. Italo Brown, emergency physician, assistant professor at Stanford on the West Coast, also social emergency medicine clinical instructor, and I also work with a couple of groups, Trap Medicine, which is a barbershop-based health initiative for Black men and boys, where we try to improve the health and wellness of that community.
So as everyone can see, we have some panelists in great areas and doing great things. And you probably heard a lot of the things that we do and we touch on. Gun violence tends to pop up its ugly head, as I like to say. As we're getting started, before we get started, just some ground rules. Tour for Diversity is one of those open, we prefer conversation, we prefer getting down to the nitty gritty. So if you have any conversations or any talking points you'd like us to bring up or any questions, feel free to drop them in the Q&A box. We answer just about everything. I've never seen a question any of our mentors are scared of, or any questions that we haven't been able to dig up some answers to. So feel free again to put them in the box, and we'll just continue to have an open conversation here. This is being recorded, so it will be shared. We will post it to not only our YouTube page, but the Health Professions Week will also be posting it there. So for prosperity's sake, I guess everything we say is about to become part of the internet lexicon here. So we are going to get started with kind of an overall topic, so we're all on the same page. What is considered gun violence, and why do we see it as a public health crisis? I'm going to kick it off to you, Dr. Brown.
Thanks, Love. So gun violence essentially is any violence that is committed with the use of a firearm. Typically, there's like a few different subsets of this type of violence or how it's characterized. Sometimes it's intentional, maybe self-inflicted in the sense of like a firearm suicide. It can be unintentional, the accidental injury, right? There's interpersonal violence. So we're talking about things like homicide or non-fatal assault with a firearm. And then a couple of other examples. But ultimately, what this should really trigger for you is if these deaths are occurring at such a significant rate, it is a public health crisis, it's a public health emergency. And I mean, I can't stress this enough, but we've seen how gun violence has primary, secondary, and tertiary effects. Like it ripples outward in terms of how people are truly changed by the deaths in those communities. Obviously, the person who is the direct person who receives that gun violence is affected, but their families are, our society is. We lose so much when people die from these types of injuries or from an assault. And ultimately, our approach in public health has to be multi-pronged, right? We have to think about how we can understand these risks and underlying risk factors and what the patterns of the deaths are, how we continue to intervene or prevent these issues, and using as many different groups, bringing them out of their silos as possible to try to reduce the number of these firearm-related injuries. So I think that that's a decent overview. Why is public health? Why it's a public health issue? And just for perspective, you know, we've tackled a lot of things via the lens of public health. Unfortunately, we have not been super successful at getting these numbers to be significantly reduced. There's a policy element to it. There are actual availability and manufacturing elements to it. So we have to think about this through a few different lenses.
Thank you for that. That is very, very true. And we're going to try to tackle as many of those lenses as possible. But, you know, they always say you can't have a good discussion unless you're all speaking the same language. So I would like to kick it to Dr. Haamid and make sure we're all on the same page. Could you hit us with some lovely stats, with some things you think we all need to know and be aware of? Anything you think that should be brought to this conversation to start off with? Oh, you're on mute.
Rookie mistake. Dr. Brown, thanks so much for getting us started, and love for moderating us. But yeah, I do have some things to add. Here are some slides that are for sharing. Can you all see those slides?
Beautiful. Great background. I don't know where you find this, but I'm going to steal it.
So these are just some statistics. Gun violence is a public health epidemic because, like Dr. Brown is saying, it completely is an epidemic, and it's not, I don't think it, when I was in training in medical school, it wasn't talked about as a public health epidemic. I think just recently we're looking at the disparity as it relates to the communities that are disproportionately impacted by gun-related injuries, and seeing that and becoming more vocal about it. We've also seen that research has been lacking in the area of gun violence prevention or gun-related injury prevention. So here are some statistics. I grabbed most of these off of Giffords in Everytown, and I've included links at the very end. So in case you're watching and you want to read a little bit more about who's impacted and how they're impacted, there's a few more resources. But just to be brief, about 41,000 Americans die each year from gun-related injuries, and most of those gun-related deaths are due to suicide. Specifically, about 60% of them are due to suicide, and around 38 to 39% are secondary to homicide. And the last percentage or two are from police-involved shootings. Some of those are misclassified as homicide as well. So the last 1 to 2 are police-involved, unintentional, meaning we don't really know, or if they were accidental in some way, such as like you watching the news and you see a child accidentally shoot themselves with a gun, or a friend with a gun. And the last bit are undetermined. So we don't really know why they occurred, but someone died secondary to the usage of a gun. And this problem is relatively unique to the United States. So here in the US, we have a crisis on our hands that other high income nations do not have. So we lead the world as it relates to high income nations with gun related injuries, and we lead it by a significant margin. So the United States is here in the orange, and on our y-axis here, we have gun deaths per 100,000 people, and you see that number for United States is close to 12. The very next country is Switzerland, and it's all the way down at 3. So that's a huge, huge difference in numbers, and the rest of the countries trail, below that 3 mark, 3 per 100,000. So United States really does have an issue here. And there's multiple reasons why that is, and we'll talk a bit about that later. In fact, the United States accounts for just 4% of the entire world's population, but 35% of global firearm suicides. And Americans here in the US are 25 times more likely to be killed in a gun homicide than people in other high income countries. So that's a stark statistic. And when we look at the leading causes of death for children, they've been investigated thoroughly. And what they found is that gun-related injuries or firearm-related injuries are the leading cause of death for children, adolescents, teenagers here in the United States, followed by car accidents and other things like poisoning and childhood cancers. So again, firearms are really impacting our young people here in the States. And when we look at homicide, it disproportionately impacts Black Americans or Black communities. So suicide, we see the completion of suicide mostly in middle-aged white community. And they lead all other categories when you look at, or middle-aged white men lead other categories when you look at gender, race, ethnicity, as far as the population that's most impacted. Now, if you look at Black individuals and specifically Black men, that number that are impacted by homicide are exponentially greater. And that is especially significant when you look at the percentage of Black men in the United States, because they are a minority in comparison with the rest of the population. So if we look at homicides in particular, you see Black men, that category, they're heavily impacted when we compare them to white individuals, Hispanic individuals, American Indian, Alaska Native, and Asian American Pacific Islander. In fact, Black men make up 52% of all gun homicide victims in the United States, despite comprising less than 6% of the population. So that is where I kind of focus a lot of my energy as far as it relates to EMS and health equity. And that's because I think all of us, there is a statistic that says all of us will be impacted by gun violence at least once throughout our existence here on Earth. And that'll be either directly toward us or someone that we cared about or a loved one or someone that we know about being impacted by gun violence. And seeing that really ravage our communities is what got me into medicine. Not only just guns, but diabetes, heart attacks, everything like that. That disparity there disproportionately impacts Black individuals. That really was a push for me to go into medicine, and it's a push for a lot of us to go into medicine as well, so that we can be representation or be representative and be an advocate for this population. But if you'd like to learn more about gun violence and the statistics, you can visit the Giffords Law Center to Prevent Gun Violence in Every Town for Gun Safety. And they have some great pictorials there and some infographics that make it a lot easier to read. And that's all.
That is excellent. Since you have those slides, if you could do one thing for me, since those slides are on your computer, if you could copy and paste those links and throw them in the chat or or whatever we have. I know people would love to look those up, because that last stat was, I don't know, to me, obviously I have a personal investment in it, haunting. 52% of gun homicides and don't even make up double-digit percentage of the population. That's extremely haunting. And I feel like that is where we need to work on. And so anyone who just saw those slides, I don't think you can see those numbers and not attach the word public health crisis. Our country is leading the world by leaps and bounds, something we are not even, no one's even close to us if you add the next 2 or 3 together. And I think a part that most people probably don't think about, because we're so focused on homicides a lot, suicides is a lot. It is a finality that comes with using a firearm in that state or in that way. So when it comes to suicide death, this public health crisis is now, as a lot of people try to marry them together, a mental health crisis as well. When we both have both of those things going off in this country put together, we can lead to a lot of lives destroyed, and that's pretty sad. So I would like to kind of like go around, because when we see those numbers, we have to believe that we are each affected by gun violence in some way. So if, starting with Dr. Brown, if you have any kind of stories, non-medical, outside of, being at work in the white coat, that you'd like to bring forward about gun violence and how it's impacted you, we'd love to hear it.
Certainly. And I really appreciate those statistics, because whether we want to acknowledge it or not, these are people's family members, sons, fathers. They are loved ones of other individuals, and their life essentially is just truncated a lot of times far too early. And, the interesting thing is we're coming off of what I would consider to be a very interesting time. A week ago, we lost one of the most, I guess, well-known figures in hip hop, and a member of the Migos, Offset, Takeoff, and Quavo make up a group called the Migos, and the youngest one is Takeoff. Takeoff essentially is somebody who a lot of rappers know, a lot of people who listen to music are aware of, and he was shot and killed. And so this is not the first time someone who is known in popular music has been shot and killed. And we can talk about the trends of these folks being shot and killed. They're all young Black men. They don't live to see the life expectancy of average Black men or average men alone. So if you think of the average life expectancy at 68, these men are dying at 28. So that's very concerning to me. But to bring it and ripple inward, like I said, is essentially that these are large, well-known people, but everyone has a story where they know someone who was shot or killed or taken off this earth because of firearm related injuries or violence. And the first time for me was probably when I was about 11 years old or 12 years old. A young man who I played basketball with, he was killed. And this is in Sacramento, California. And hearing the story of how it happened, it was gang violence or gang related. And he essentially was shot, I would say probably purposefully, but over a small dispute. And to know that this happened when I was 11 and it is still happening today is very saddening. As a healthcare professional and a public health practitioner, seeing that we have not come up with solutions that can change that number in the course of my lifetime is alarming. And it makes me really wonder how come we have not accepted that traditional energy, additional energies, additional resources need to be driven in this direction to help us solve this problem.
Thank you. I will pass it to Dr. Haamid and let her go next, and then I will pop up with my non-medical story after her.
Oh, yeah. So, I mean, gun violence will touch all of us, I think, within our lifetime. That's what one of the statistics are. So when I was a medical student, so I wasn't even, working or anything like that. I was going to visit my grandma who lives off in Chicago. She lived off 83rd and Drexel. That's on the south side. And I had left my house and I was supposed to bring her something. I can't remember what it was, some type of snack, some type of treat. You know how grandmas are. So I was driving and I was like, oh man, I would have to turn around and I don't really feel like it, whatever. She'll be glad to just see me. So I just kept going and just, said, whatever, grandma just be a little mad. And I got out of the car and this is right down the street from where I went to elementary school, just 2 blocks away. She and my granddad used to walk and pick me up, pick me and my brothers up, just walk down there and we'd walk back to her house. And we got out the car, went upstairs, sat down, and within 5 minutes of me getting there, there was pop, 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 skirt, skirt, pop, 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 skirt, skirt. Obviously, there's a drive-by, happening right now. My 80-year-old grandparents are sitting in the chair trying to duck down. And in that same neighborhood, my granddad had already been shot probably 10 years earlier while he was sleeping in the bed. But at that time I was a small kid. So when I saw him on the news, it wasn't like crazy traumatic. I didn't really know what being shot could like kill you, and really injure you and psychologically mar you. But this time it was like I was more informed. I'm an adult now, and just seeing them trying to get down on the ground, just as elderly people, innocent people have done nothing. I really saw the look of fright and horror on their faces. And I felt so, frightened inside. Like, what if a bullet comes to the glass and hits one of them? Like, what am I going to do? And I couldn't really pull them onto the ground with me because they're old, right? So just have old bones. So they just went down slow motion, just trying to duck, and finally it was all over. And I went outside and remember I was supposed to turn around and go get my grandma a snack, but I didn't. And I turned around, I came downstairs, bullet holes in the car that I had just parked. So I just imagined, dang, there would be a news article about some girl just going to visit her grandma. Or, the typical news article where people are victimized from gun violence and automatically painted as, deserving of what happened to them because of the color of their skin. And I just wondered what the news would say about me. But I then looked up and saw the rest of the neighborhoods walking to Cottage Grove, which is a big street that runs north to south in Chicago, from the north side all the way down to the south side. And everybody's walking that way. So I started walking that way. And there's about 3 maybe teens, young adults laying in the street, just bleeding out, not moving, obviously, dead. And no one, obviously this just happened. There's no sheet over them. There's no ambulance on scene. So I looked around to see who's looking because I'm a medical student at the time. And, I've seen things like this before, but who hadn't seen stuff like that before? the 5-year-old standing next to me, that was just outside playing with his friends, the 10-year-old, the mom that has a kid, probably those kids' ages. She hasn't seen something like that, or maybe she has, I don't know. But I just thought about the collective trauma of that neighborhood, having to hear that, having to duck down in fear of their lives, not knowing whether or not they would be alive or dead within the next couple of seconds. And then the trauma of seeing these kids in the street, because in medicine, we compartmentalize, that's at least what's taught. You're in this traumatic situation, something bad happens, and you put it into a box. You're supposed to bury it and kind of disassociate, disconnect, so that, you don't take that trauma home with you. But really, that's not a real thing, right? That's a number of the reasons why we hear about burnout and people kind of not really enjoying their job and not wanting to go into work and having an apathetic attitude and being depressed with their job, is because of all that collective, or in part because of that collective trauma that you absorb. So despite us all, it feels like the rest of society says, sure, gun violence happened, or your friend that in school died or passed away, but we still expect you to do X, Y, Z and show up and be your 100% full self. And there's very little pause to stop and say, how are you? Because psychologically, you cannot undo what you saw. You cannot forget what you saw. You cannot erase what you saw, because in your mind, there was a cortisol surge, synapses reformed, and that moment lives on with you forever, and it informs who you are for the rest of your life. So you can imagine living in a place like that, where things like that happen so commonly, so frequently, that you lose friends left and right, how that might change you and your outward look on life, and your outward look as far as your value, or what you see life, or life's, what is life's value, what is your life value, and what are the values of the lives of the people around you. So I would say that's one of my non-medical stories that I think has certainly informed, who I am today and what I do, and why I think it's so important for more of us to talk about gun violence and to advocate and to research and to implement different interventions, and to be mindful of, the root causes of it, and how to mitigate them.
I like that story, especially the sound effects. I feel like that really brought something to the story for me. It just made it more alive. But I think my non-medical story ties into a lot of what you hit on the end, which is like the psychological trauma of it. So I remember when we were talking about this, kind of like pre-gaming and going over everything, I was like, I don't think I can, at the forefront of my head, picture any friend or family member that I know that has passed away from gun violence. Like, I don't think I went to a funeral due to gun violence. But I also don't realize how much I have, like you said, trapped and put in a box and shipped off somewhere due to gun violence. My family moved to Houston when I was 11, but I grew up in Oakland, California. Stayed there till I was 11. You don't really realize when a nickname, you're part of the city, is town, until you realize that there are a lot of ghosts haunting that. The sound of gunfire is completely ignored by my brain. I outside of playing a video game, even then, gunfire does not make me, I jump and move to one side, obviously, to avoid it, but it's no longer an unknown. It's no longer a scary thing. It's a protect yourself type of thing. And that is what happened when those synapses were formed growing up in Ghost Town. Riding your bike, you know that we all joke about the streetlights thing, but that is put out for a reason. Hearing and seeing bullet wounds all along going between my house and the corner store, which was even like a full block away, became commonplace to the point that you knew gangs existed either to protect oneself or to protect one's territory. And it became an unfortunate part of life. One that I'm glad I didn't have to participate in fully, but one that even to this day, 30-something odd years later, I realize it plays a portion in how I like interpret and see those things. And now it is a sad nature to me that gun violence has become a numbing effect in my life. And that is not what it should be. And it's my hope that, starting with our small little talk, I guess, and going forward, we can pull out some teasers, hopefully for the American society to take, and we can fix some things. But I do have a medical or work story, I like to call it, for gun violence, and then I'll pass it to you guys if you have any. The hospital I work at is a small single coverage hospital, meaning there's only one physician on at a time. And it's not in Nashville proper. It's about 30 to 40 miles away in a place called Springfield. And I remember just working a shift, and we're not a trauma center. So for anyone who doesn't work in medicine, that means when people get shot, they are not supposed to come here. It's not where it's supposed to be. It's supposed to go places with large resources, more surgeons than you can count, vascular and everything else. But people don't know that. Your common person walking the street thinks a hospital is the hospital is the hospital. So we are there, and all of a sudden, I have someone come in, and the nurses are like, stabbing in a patient, gunshot wound. And I was like, oh, not here. Like you can't come here. So now I have to run and scramble, and I see, of course, African-American male. Heart drops, but he's doing okay. We start working on stopping the bleeding as best as we can, and getting everything settled up. And then another patient stats in, gunshot wound, African-American male. I now have 2 gunshot wounds at my non-level trauma hospital. And of course, the first thing occurs in my head is 2 gunshot wounds, small city. What's the chance they were in different places? And anyone listening, you're right, it's low. They were in the same place, shot at each other. Later to come to find out from police, there was a third person involved who didn't make it. So now I have 2 people involved in the same incident in the same place. Families are all scared and all worried. And I have to now keep them apart. So now I have making sure everyone's resuscitated properly, no major injuries, who I need to get to the trauma center. I got, moms and dads on each side wondering if their children are okay, and then making sure they don't know each other or are there, and no one comes in security-wise to, as people often say, finish the job or retaliate. I remember taking the time to talk to one of the young men who had the bullet still in them, but luckily no major organs and was going to be able to go home, and sitting down with them and just asking, why? Like, how do we get here? We're not in a big city, like, why this? And he had no answer. Just, I was out and someone talked to us wrong, and this is what happened. And it kind of hit me as a thing that, like, wow, everyone working that night saw again that lovely American tapestry of Black male violence, and seeing that we had 1 homicide now and then 2 men in the same spot. So I felt like I had to be a paragon of my gender and ethnicity, and kind of stand up as a physician, like, hey guys, this is violence. Anyone can we see assaults here all the time, and we don't see Black men for assaults. So just because there's some gunshot wounds, let's not enforce any stereotypes or push anything up. But I tried to take those moments to speak with each one of those men, and hopefully be a little piece of change in their life, hearing and seeing that there's a brother on the other side who's like, y'all got to stop this. I haven't seen him since, so hopefully it worked. But that's a time in an event for me I will never forget, having to deal with that in my tiny little shop. Atalo, do you have any stories from working out there in California?
I mean, I have a couple. Well, I trained in the Bronx, New York. That, in itself is a very rough and tumble environment. There was a particular night I remember around 3 o'clock in the morning, similar story, 2 Black men my age, so in the mid 30s, being brought in at the same time for gunshot wounds. One was to the face, the other one was to the head. And the story is essentially that they were coming home from a party, and it was 3 guys in the car. Guy in the back seat gets an argument with the 2 guys in the car and decides that he wants to shoot the driver. Then the front seat and the passenger seat are brothers. And so when he hears the sound of the gun essentially discharge, he turns, and so the car starts swerving, and he tries to stop him from essentially brandishing the weapon, and he fires at the guy in the passenger seat and hits him through the cheek. And so they're both brought in because car wrecks. Guy gets out and flees the scene. He gets into the car. I mean, the passenger essentially moves his brother, drives to the nearest hospital, which was a hospital that transferred him to us within moments because we lived literally down. Well, I mean, the hospitals are literally like 2 blocks away. So EMS just put him in there, brought him to us. And this is one of those unfortunate stories where you do everything that you can and you can't save one of them. The one that we were able to work with, I just remember him looking up at me at the head of the bed and just asking why we do this to each other. Just why do we do this to each other? And I'm in a room full of non-Black people. So, the entire medical team is, again, non-Black. And so in that moment, I thought I would say something a lot more elegant, but the only thing that came out was I was like, man, you still got a brother right here trying to help you. And so kind of that emotional moment really made it real. It made it very real to me because this was like setting me up for the entirety of my career where I would see this moment occur repeatedly. And wanting to be a person who focuses on root causes, just thinking about like, how could I have stopped this? How could we have changed or affected this at the root? The only other quick story I had, and I'll try to make it very brief, is they're looking at another side of gun violence. Here in Stanford, I had a guy who came in essentially self-inflicted gunshot wound to the head. And the part that hurt me the most was not the fact that it occurred, but it was, when you share this information with a family member. And unfortunately, the family member was a medical student, and so this to me was the first time I ever had to break, news of someone's parent, having taken their own life and seeing the student essentially crumble in front of me and then having to assist the student in trying to convey that information to the mother, who was the partner of the person who took his life, in another language. And so it's like all of these different social complexities are happening at once and trying to kind of navigate this as a clinician. And the part that I kind of had the most difficulty with was he wanted to see his father. He was like, I need to see this. And he kept saying that. And so in that moment, just trying to offer as much support as possible, but realizing how complex this issue is and that there are, so many different underpinnings, whether we're talking about mental health, we're talking about people who are going through personal trauma and the way that they deal with it. And in general, accessibility of firearms and how we can be better at understanding how they are truly decimating families and lives in the process.
Two extremely powerful stories. The social complexity of different languages, I can't even fathom that. Dr. Haamid, we're going to talk about a work story for gun violence and how it's affected you.
Yeah. So I feel I trained in Chicago. I still work in Chicago. So I mean, we see so many patients impacted every single day, every single shift I work, there is someone shot that's coming into the emergency department. I think as a medical student, I was really taken back by how small, because the first patient I had on my trauma rotation that was shot, I was like, whoa, it's crazy. I wonder what the wound looks like. I had never seen a real bullet hole before, like up close. And it was tiny. It was a tiny little wound. I remember thinking, how could something so small cause, you to lose your life like that? But then I've seen it over and over and over again, so that guy that says, why do we, that you just shared, why do we keep doing this to each other? I mean, it's just, I felt that when you said that, I've certainly had a number of patients that have kind of said something similar. And I think that working in a trauma center where you have a lot of people, shot or stabbed, most of those patients, at least in Chicago, are going to be Black men. And having family in and around the Chicago area, it's always concerned that you're going to know somebody that's brought in, right? It just sits in the back of your mind, kind of eats away, but you try not to focus on that. But yeah, there was a guy that came in that was a traumatic arrest at one of the hospitals I was working at, and he wasn't doing very well. And one of the technicians that was working came over. to do something to help get him, settled into the emergency department when he got there. And, his heart had stopped. So we were doing all these surgical procedures, to restart his heart. And she looks down and she says, "Oh my God." And it was her brother. So the worst situation, right, to ever be in is to walk in and it's your own family member standing there, or there, that's dying in front of you, secondary to, gun violence. And, I've just heard so many things over the time, just working in the trauma unit, specifically as it relates to trauma. And I think that's because when people come in and they have a heart attack, or, they're old and they have, pneumonia, and they come and, the oxygen's low, they pass away. It's like the family was kind of expecting that this could be a possibility, right? So it's not as a complete shock, but anytime anybody is killed with a gun, it's a complete shock, right? It's very sudden. You couldn't have predicted that that was going to happen that day. But I think specifically for Black people and Black moms, I really honestly, being a mom myself, like in the back of our brain, and maybe, maybe dads too, but I'm not a dad. I don't know. In the back of our brain, there's a prayer we're saying like every day that our kid will be safe, and that nothing will happen to them. But then when you're working in the trauma unit and, a mom comes in just driving and is shot in the head and drives fast, still conscious, driving fast to the hospital with her kid in the back seat. And, she's coming in with blood dripping down and just screaming, check my baby, is my baby okay?" I just cannot imagine driving and not knowing whether or not your child's been hit in the back because they're not saying anything after you hear bullets ring out. But that is literally the experience of people that live on the south and the west side of the city here. And when they find out that something bad has happened, there is a blood curdling scream. And I think that scream is not just because this is so sudden and terrible, but this is all sudden and terrible, and it's something that you wished and hoped and prayed would never happen since the day that kid was born. And now here it is that, it's happened to them, the thing that you feared the most. So I just have way too many stories of just being here and being in this practice, and it's just a terrible thing.
I hate that scream.
Yeah.
I hate hearing it. You never get used to it. You can't block it out. They haven't even been my patient, and I've been on the other side of like the ER before, and I heard that scream. I knew exactly what happened.
Yes, exactly.
It is terrible. And I am a father. I have little Joseph and Jacob running around, and that's a prayer I have to say. I don't, at this age, all they want to do is go to the playground and watch Coco Melon. Anything can happen at any time. And at some point, they're not going to watch Coco Melon to graduate into other things. And you just hope you want to keep it from that. But from hearing those screams, Dr. Haamid, and seeing that family collapse in your hand, what do you usually bring forward, if you can? And if you have no answer, that's also fine. What do you bring forward to them for a sense of healing? Or what do you bring forward to the community for a sense of healing and improvement? A lot of focus is on Chicago, but it happens in any large major city, this low of gun violence. What's something we should be bringing to those community and those participants who are watching us right now? What should they be thinking or saying?
So they should be thinking about the root cause of, what's going on and trying to address those root causes. Because right now we see that there's a lot of attention on stricter punishments or harsher laws. And, I get that, but we really need to look at why is it occurring in the first place. And, a lot of people are like, when it relates to suicide, there's been a ton of research, that shows that, suicide, a lot of that is due to, depression, mental health issues, or high stress situations, difficulty coping with some of these high stress situations, lack of support systems, things like that, feeling isolated, alone, and that you'll never get out of your situation, leading to feelings of depression, hopelessness, and then finally the thoughts of taking your own life. So that is a driver behind a lot of suicide attempts and completion of suicide. However, when we look at homicide, there hasn't been as much investigation, but there has been some. And the root causes, I mean, you can Google root causes of gun violence, and I'll pop a link in the chat too for like a couple sheets takeaway from some of the literature that's out there. But the root causes of that disproportionate amount of homicide in the Black community is really like what we discuss all the time: social determinants of health. Inequality and inequity in a lot of spaces that lead to those same feelings of hopelessness, that you'll never get out of your situation, that your life is not valuable, and neither are the people around you, because they'll never get out of their situation either. And the continued exposure to violence over and over, those things fuel future violence. And once you've been impacted by being injured in some way, you're more likely to injure another person in some way, and also start to cope with drinking or drug usage, and also development of PTSD and depression as well. So it's kind of a cyclical symptom, but there's a lot that can be done to address the root cause of violence, or at least homicide-related violence from the emergency department, since that's what we're talking about specifically. One of the things I think is really well thought out and really well done. Step one is that violence intervention personnel. So when I trained at Cook County in Chicago, we had violence interrupters. They were called Cure Violence, or currently they're called Cure Violence. Can't remember the name of them when they were at the county, but when they would come in to the emergency department, we would put out a page: hey, this person was just shot, can you dispatch somebody? And it was actually a group of men that had actually been in the community. Maybe they had been impacted by gun violence as well. Maybe there was someone that harmed somebody with gun violence and decided that they want to change their lives, and then also change the lives of other people, around them. So they would dispatch someone to the hospital to come meet with the person that was harmed, address psychological, issues that are going on, because they've been through this and they have training for that. And then at the exact same time, they're dispatching someone to the scene of where it happened, because who's there? There's friends there, there's family there, people are distraught there. And what you're doing is you're trying to decrease recidivism, decrease the likelihood that they're going to turn around and shoot back and harm someone else. So those two things together, I think, are really helpful. I'm currently at University of Chicago, and we don't utilize Cure Violence, but we have a violence interruption coach that's dispatched down. So with every trauma activation, they come down, doesn't matter what kind of trauma it was, assault, battery, stabbing, shooting, they'll come down and they meet with the patient at bedside to address what's going on, and to make sure that they feel supported and they have resources as well. So I think that's one. And then number two, I think anything that addresses social determinants of health, anything that addresses the feeling of hopelessness, that can be from, food drives, that can be from having a food pantry in your emergency department, that could be, giving patients like the number to the nearest food pantry, or a food pickup location. That can, when you're feeling good in one area, that bleeds over into other areas. So if you're feeling down and, maybe you don't have access to, resources as it relates to education, as it relates to income, as it relates to, public services, putting people in contact and supporting people when they're not met, when their needs aren't met, I think will overall decrease the rates that we see of, depression and hopelessness, and a lack of a sense of upward mobility. And I think the trickle down effects will be less interpersonal violence overall, and specifically less gun violence towards each other.
Thank you. Dr. Brown, any thoughts along that topic of healing and improvement in our communities?
I mean, I think that the other part that has to be added is a continual community-driven conversation, something that extends beyond the walls of the hospital. I think that we do the best jobs that we can in each of our, trauma centers, where we have those resources. In the Bronx, we had Stand Up to Violence, and there's different initiatives that focus on violence prevention at the site of the hospital. But ultimately, what it comes down to is how people extend into the communities and essentially amplify this conversation. I do barbershop-based health initiatives. One of the things that we focus on in our conversations is really understanding what these root causes of violence are and how people are differentially affected by it, leading through education. There's 1,000 different other community initiatives that help. For a while there was a, turn in weapons, firearms initiatives, and things like that. They didn't have the greatest outcomes because of that. And so we've constantly gone back to the drawing board to figure out what does it really take. And a lot of times people will say that it is about knowing community members, really understanding that old school way of we take care of one another and having accountability from within the community, because ultimately these same communities end up being overly policed as a result of these types of incidents. And so I think that that's one of the hardest things the hardest pills to swallow, is that some of these issues will not be addressed effectively with law enforcement involved, will not be addressed effectively by making different policies to essentially exact justice, but really it comes down to communities understanding the fabric and the fibers of what makes that young person who may have drawn a weapon at another person, what they've been encountering. The other part I was going to add essentially is I think that there's been a tendency to not introduce these topics in conversation at younger ages. We've essentially seen young people be surprised by the advent of gun violence, and that has to be reversed. We have to have these conversations at ages where kids are at least appropriate in terms of their ability to kind of understand, but we should talk about what those things are. Some of the large scale policies that I think have been helpful, talking about firearm storage, how it can be properly stored, how to make sure that people in the household understand that this is either off limits or a actual weapon. That has to continue to improve. And then at the state and federal levels, continuing the conversation around like access to firearms, what types of firearms should be publicly accessible, right? Assault weapons, these things are not something that should be in a person's home outright. And I think that as we continue to be engaged at a civic level and lobby effectively and continue to drive funds towards the action committees that seek to improve these policies, we'll see things change. And then I'll say that at the last part is, these large payouts from legislation or cases rather, where someone is murdered because of these assault weapons or large mass casualty events, like these payouts are fractions on the dollar. They don't necessarily equate to the life that's lost. You can make a payout of $70 million and it still is nothing compared to seeing those people no longer on this earth. And it's nothing in comparison to the amount of money that the firearm industry has access to. So I just encourage people to be as informed as they can about, what the policies are at the state and federal levels, and then at a local level, engaging in community-driven work and hoping to support, even at the financial level, if you have it, people who are doing that work effectively.
Thank you for that. I don't think on average we see those large numbers, but I don't think we all truly stop to think about what those numbers mean to someone's life. And
if it were appropriately funded, or not appropriately funded, if the legislation and the cases were appropriate, it still would not be enough to bankrupt the NRA or bankrupt the gun industry.
True, very true. Now, I started off this entire panel saying T40 doesn't run from the hard questions or the hard topics. So I want to hit a couple of them. Most importantly, I want to again remind everyone, please put your questions in the chat. If you want us to answer them, we'll answer them straightforward. But we have a couple of hard-hitting ones ourselves that we will get to as we get close to our hour marker here. We started a few minutes late. But let's get to the obvious question, starting with you, Dr. Brown, since you're unmuted. Do you own a gun, and will you ever own a gun?
I do not own a firearm. That's a personal decision that I've made. And I think that part of it is my assessment of personal risk. I don't have children. I don't have a partner. I tend to, man, I weigh 215 pounds. And if there's something that I can handle, I will handle it. But if there's a firearm involved, my life is worth more. I made that decision, and they can have whatever they want. That's how I operate. But I am not passing judgment on anyone who does own a firearm. My main decision point is it's educated. I come from a place of knowing how to work a firearm, knowing how to secure a firearm. My father was a military man. He taught me when I was about 8 or 9 years old. And I have all friends that I grew up with have essentially become police officers. And so we have these conversations on an ongoing basis. But my personal decision was, I don't think I would need a firearm until I am at a point where the cost of losing the lives of the people in a room is more than what I can bear. So I'm not there yet. I'm okay if my life is taken by firearms, and I'm okay with approaching it with open arms. But I don't think I need a gun right now.
Dr. Haamid, do you own a firearm, and will you ever own a firearm?
Yes, I own a firearm. I purchased a firearm when I went off to fellowship, actually, because I was moving to a new state. I'd be alone. I didn't know how people feel with people like me living, in the neighborhood, and I just don't know. So there is no, alarm feature that I was getting installed or anything like that. And realistically, I weigh, 125 and I'd be thrown out a window. So yeah, I purchased a firearm at that time. I underwent firearm training. I had to take a course with the place that sold it. I forgot the name of the institution, but they offered a course, and I took that and learned how to handle it safely. And I'm a big proponent of keeping it safe and keeping it locked. So it's in a lockbox with a lock. There is a key that's separate. And yeah, what was I going to say? And I think that, I'll be upgrading the way that it's locked to maybe something a little bit more, intricate, maybe something that that has a code or reads fingertips or something of that sort. I've been looking into that now that I have a 2-year-old. But it's for protection of myself, and now it's for protection of her. I live, in this home, and, we sleep on one floor, and, sometimes I hear creaking downstairs, and I'm like, who's that? And it's the dog. So thank God. But if it wasn't the dog, what would I do? I go on to that, that secret place where, and hopefully keep myself safe. But that is my reason for having a firearm. And yeah, I do have one, and it's locked up safe.
Those are some very good reasons.
Mhm.
I will not put out any question I won't answer myself. I do not own a firearm. My wife's a pediatrician, and she's anti-firearms around kids, but I do shoot guns virtually on the PlayStation, but in real life as well. I have gone out and tried them, used the firearm. I'm one of those people that kind of like Tyler said, like, I don't know in my life where I'm gonna use it up front. However, if people are right and that zombie apocalypse does occur and I come across a
You
firearm,
want to know what to do.
exactly. I need
It's
to know.
similar.
So I'll own it myself, but if I come across one, I need to know how to find it, reload it, safety on and off. And so, yes, I believe they are tools, and lots of tools can be dangerous. And I just don't have one in my house, and probably won't purchase one. Next hard-hitting question. And by the way, there's a shout out for you, Dr. Haamid, in the chat. Next hard-hitting question. Do you guys think there can be real change in the United States of America, where we live, without Second Amendment change or alteration? As long as people feel that it's their right, can there be any real change? Can we really affect what goes on in our lives? I'll put that out there. Anyone wants to go first, go first. Yeah, go ahead.
That's a great question. Love. I would like to imagine that we could all be, I don't, what I watch, Sesame Street with my kid, and sometimes I'm like, man, there are some lessons in here, can we get along? Like maybe all of us should just go back and watch Sesame, with the roots of where it started. Before we, got trained up in these different ways to be so divisive. But I would like to think that we're able to exist as a society and, keep the guns to ourselves, and work on the root causes and be able to move forward in a healthier fashion. Um, I don't like the idea of, stripping everything away from everybody. I just don't like that idea. But if that's that needs to happen to keep everybody safe, I'm always for people keeping people safe and keeping people alive. So, that's my thought process. I don't know if it has to come to that, but if it has to come to that, let's do it, So you just have to beat me up,
He said to learn to live, to fight another day for Friday. No,
Yeah, right.
right. No, in all seriousness, I don't think that this amendment will be somehow taken away. I think that the interpretation of it will change. And I also think that again, I keep bringing this up. It's not necessarily, I think that it's the type of weapon will essentially be altered, what someone can have. Because when you look at automatic weapons versus semi-automatic weapons and shotguns, like they all have different purposes. And so when you hear more cases of people like having mass casualty events, I think that the automatic weapon is going to have stricter policies. And that to me is it's not necessarily an amendment, right? It's an interpretation of it. It's like, yeah, you can be able to have a personal weapon, one to protect you and your family, but that doesn't necessarily mean it has to be an automatic weapon. It can be a shotgun. It can with a beanbag round. It can be like all these different ways that people use the weapon. And so I think that that's going to happen. The other thing that I'm more so, I guess, anticipating is that there will be areas and territories throughout the country where firearms are going to have more like different policies altogether, where I think that you'll see communities say, we would like this to be a gun-free zone. And people may buy into that concept. I think that there's more than enough evidence of it. And there's more than enough evidence of communities kind of like seeking this self-policing, self-regulating structure. And I expect that to happen. It's not going to happen in the next 5 years. It's not going to happen in the next 10 years. But I think that that's realistic.
I think I'm on that train as well. Second Amendment isn't going anywhere. We're not going to change it. It's written down. I think the interpretation has to come a little different. And I'm going to use the crack/opioid epidemic comparison. Crack was ravaging Black communities. Yeah, some laws here and there, not a whole lot. Opioids ravaging some other communities. Now, all of a sudden in Tennessee, I can't prescribe more than 3 days worth of opioids. I can't, without a pain clinic and seeing somebody, I can't give them a long extended prescription for 30 days unless they're in this clinic. All opioids are preferred to be sent electronically rather than written down in a pad because people were stealing pads and writing out whatever they wanted to. There's all these hoops we have to jump through now because of what the opioid pandemic has done. And have we taken away opioids? No, we just put a lot more safety measures in place. So I think that's probably where we're going and should go with firearms a lot faster than we're going right now. I hate that, you're probably right, Dr. Brown, 5, 10, 15 years away. But yeah, I have seen assault rifles and do not understand how anyone on the street can need them. The people who are saying, well, what if the government turns against us? They gonna have army guns, the AK you bought from somewhere, that's all fine and dandy, but the F-15 they're gonna fly over your head is not gonna do nothing to that. So, I think we need to put some, all right, you need to have a gun to protect yourself because you live with your child on a first story house and you weigh 110 and you can be thrown out a window, fine. You probably don't need extended rounds on that, right? You probably need 10 to 15 shots max, and I think that's where we need to start moving towards the society. Because as everyone has said and seen on the internet, when the Second Amendment was written, you had a shot, fire your gun, then sit down, then put in the pellets, then get it all ready. And we're just not there anymore. We're not there. And the last most important question I'd like to throw out here, seeing as I don't see any in the chat, is we talked about the mental health. We talked about being Black in America. We talked about America problem. When all of these things happen, especially these mass casualty shootings, the ARs, the Sandy Hooks, the Uvaldes, everything else, we start off with the conversation, we go to thoughts and prayers, and then this question comes up online. I see all the time. Well, what about Chicago? You know, why are we worried about ARs? What about Chicago? What are your guys' sentiment towards that saying? And I'll start off here and then let you guys finish. I always feel like Chicago is just a microcosm of, you know, community violence, right? Like you are going to harm the people you live amongst. In Chicago, unfortunately, it's probably one of our more segregated cities. So you have a high population of African Americans living in one spot. You have a flooding of guns coming in from, ironically, outside of the state a lot of the times, because there are a lot of laws in place. And then people end up harming one another. But I don't see anyone who gets stabbed multiple times on the strip in Broadway in Tennessee. No one comes up and says, well, what about, you know, Broadway? So I think it tends to get used as a dog whistle. It is a problem that we will have to focus on and work on, but I think it's more of a dog whistle than an actual sentiment of caring about that population. Dr. Brown, let you go next. I want Dr. Haamid to have the final say on Chicago.
Got it. There's a lot of Chicagos across the US. You can look at the top 10 list. I think that the one part that's not really mentioned here is that this is a systemic and structural racist issue. When you look at the subpopulations of people who are being murdered and clearly exhibiting devaluation or just devaluing those lives and those age groups, that to me is, you know, what drives it is, yeah, as long as this is not happening in affluent communities, as long as it's not happening to the majority population at the same rate, it's not really a significant problem. What I will share is that what makes this type of issue in Chicago super unique, and from what I can understand in terms of communities that are structured similarly, is resource allocation. You know, like how you, when you have those city budget meetings, when you have the those subcommittee meetings and how they develop resources, it seems to me that Chicago constantly is trying to do the enforcement element, that there's more money put towards, and this is not just Chicago, like I said, multiple cities like this, more dollars put towards how to increase policing of these in communities, how to increase the ability to restrict guns, and I don't think that really solves the problem. I think that there is a reprogramming element that needs to occur and how we think about it. And unfortunately, in the process, Black and brown lives will continue to be lost at an alarming rate. The one argument I have to absolutely kind of like go against is that music or the culture is what drives the violence. I think that you can't continue to blame the way that people express themselves, and you can't continue to blame that the social circumstances that they've been placed in is 100% of their own fault and of their own doing. If you can't acknowledge that these environments and cultures were intentionally created, then you're missing the picture altogether.
Excellent points. And Dr. Haamid, the last point on what about Chicago?
You know, when people say, what about Chicago? I say, well, what about this place? What about that place? Because like Dr. Brown said, Chicago is not incredibly unique. And in fact, you know, Chicago is always regarded as one of the most violent cities, right? Where homicides are occurring every day. But when you actually look at the numbers and compare it to the density of the population or the number of the, you know, individuals that are within that community, these rates are not outliers when you look at other major urban cities. So I agree that it's kind of like a dog whistle. type of politics type thing. Similar to when people are saying, well, we need to fix this in the Black community. And then they say, well, what about Black on Black crime? It's a dog whistle type thing, to kind of push away from actually doing things of substance that matter to really address the problem at hand. So I think that, Chicago is a heavily segregated city. It's within the top 3 of economic segregation and racial and ethnic segregation. With that comes poverty driven in one particular area because of the flight of individuals who have access to higher income, secondary to structural barriers and structural racism over the years. And then we have lower finances coming into certain areas of the city. Poverty is strongly associated with interpersonal violence. So with anybody saying, what about Chicago? I would say, what about the structuring of inequity in Chicago and the structuring of poverty in Chicago? Let's start there. Let's address that. Let's do something about it. And then we can talk about, what about the violence in Chicago?
I love it. And we started late, so we're gonna wrap up late, but we don't leave students, we don't leave people hanging. So the final question, everyone will have about a minute each to answer, will be from Kendall. And it says, do you think people should go through more training or testing before being able to purchase a firearm? I'll start with you, Dr. Brown.
I get this question often. I think that you have to be very intentional about what the testing is and how you define eligibility. Like, what is the passing? That to me is a very slippery slope. And also because mental health or these types of the things that you're trying to screen for are along a spectrum as well, right? So it may not be present at one point, but then it develops over time. So how often are you testing somebody? How often are you doing these screens? So it can be just a very pointless tool if it is not thought about very intentionally. And the last point I'll make about it is this: I fear that in the process of trying to screen through who should have a gun and who doesn't, you will eventually create such a market for these weapons that have nothing to do with it. And it can have a refractory effect where more people are looking at Black market opportunities to get weapons. And it creates an arms race in that capacity.
Dr. Haamid?
I think that safer gun ownership, well, people say guns don't kill people, people kill people. That's something that I've heard time and time again. But that's saying that it is true, right? Like guns in the hands of high risk individuals, end up causing injury or death to other people. So we have to be mindful of who has a gun. And news story after news story, there's someone that has a history of some type of mental illness, has, spoken to a professional about the things that they were going to do. And those people were allowed to have access to, weapons to cause harm. There's also been, several cases, domestic violence. Those numbers are staggering, the amount of women that lose their lives to their male partners. And a lot of those women, when you look at it, them individually, a lot of them have expressed concern or have expressed or put out and gotten a restraining order against an individual, but that individual was still able to have access to a gun to harm that person, even though they were showing stalking behavior, threatening behavior, violent behavior before. So I think something has to be done. There has to be some type of line drawn to keep people safe, particularly when they go to the court system and they say, hey, I fear that my life is in danger. But like I had put that comment in the chat, I think, like Dr. Brown is talking about, there are Black markets. There are also other ways to create guns. There are weird places on the internet where you can 3D print and do all of these things. So I don't think you can completely mitigate the risk, but I do think that if there was some type of planning for some type of testing that was thoughtful, that involved multiple stakeholders from different areas that put their brains together, and a group of diverse individuals with different things to bring to the table, I think that there could be a thoughtful way of implementing some way to check to see whether or not a person should own a gun and continue to own a gun.
And to answer your question from my perspective, Kendall, I don't think we need essentially more training. It can be focused in there. And I don't think we need testing per se, but screening, I think is probably what you're hinting at. I do think we need more screening. I do not think in this country you should be able to turn 18. The day you turn 18, anyone in this country, turn 18, go get an AR, get as many rounds as you want, and then the next day go buy another AR with as many rounds as you want. I just don't think you should be able to do that without proving something. Screening. Have you ever, if you have gone and been institutionalized in a psychiatric facility for longer than 3 days for suicidal or homicidal behavior or hearing voices, you should not have access to an AR. That's just my opinion. I'm sorry about that. Do I think you can take away someone's, again, Second Amendment right to own a weapon? No, you probably can't. But I'll tell you this, I can drive my Toyota Camry, but my driver's license doesn't let me drive an 18-wheeler, right? Like, we have classes for those type of things. And I think we can we can put that towards our gun thoughts when it comes, or firearm thoughts as well. All right, we've gone past an hour. We've had great conversations here. You know, I think we're moving the needle forward. Thank you all for joining us. This is a tough conversation about where do we go from here. And you've heard some answers about what to do. So please, you can follow all of us individually on social media. I see Dr. Haamid dropped her Twitter in the chat. But if you also want to just follow us as an organization, TOR, the number 4, diversity on IG, Twitter, Facebook, we are out there. We will connect you with great mentors like this. We can keep the conversation going. And most importantly, we know that we're not going to stop. You saw the stats earlier. America's in trouble. African Americans are in trouble. African American males are in trouble. This is a public health crisis, and we intend to help stop it. So thank you for joining us. We hope that you will follow us on social media, and we hope that all of you have a good night. Thank you.